Hi everyone, welcome to Pharmacology. So we'll continue with the pharmacy exam MCQs with their answers. So today's first question. A 48-year-old presents with a chief complaint of a dry hacking cough which started yesterday. He denies fever, chills, sore throat or congestion. His only medical condition is hypertension which is controlled with hydrochlorothiazide. What would be the best recommendation for elevation of his cough? Options are dextromethorphan, phenylephrine, fexofenadine, guaifenesin. So here the answer is option A, that is dextromethorphan. The complaint is a dry hacking cough warranting the use of an antitussive rather than an expectorant. So out of these options, this guaifenesin is an expectorant. So this dextromethorphan is the only choice of antitussives provided. Next question. A 42-year-old male complains of a scratchy throat, nasal congestion and a cough that started 2 days ago. When he coughs, he brings up yellow-white phlegm. He has hypertension and dyslipidemia. Current medications include simvastatin, lisinopril, hydrochlorothiazide, carvedilol, hydralazine, isosorbate dinitrate, and amlodipine. Which of the following would be the best recommendation for this person's cough? Options are codeine, dextromethorphan, diphenhydramine, guaifenesin. So here the answer is option D, that is guaifenesin. Here the patient is experiencing a productive cough as noted by the yellow-white phlegm. An expectorant is the best agent for relief of a productive cough. The only available expectorant is guaifenesin, which works to loosen sputum and to thin bronchial secretions by irritating the gastric mucosa and stimulates secretions of the respiratory tract. A 22-year-old female presents with sneezing, watery and itchy eyes, and a runny nose. She has no significant medical history, but she is in the midst of final exams and must remain alert. What would be the best recommendation for her symptoms? Options are fexofenadine, diphenhydramine, brompheniramine, levetiracetam. So here the answer is option A, that is fexofenadine. Levetiracetam, a nasal decongestant, would offer no benefit for the symptoms described. Although diphenhydramine and brompheniramine are first generation antihistamines, both would cause significant sedation when the patient needs to remain alert. Additionally, brompheniramine is not available as a single ingredient product. Fexofenadine would elevate the described symptoms without causing increased sedation. Which laxative should not be used to treat acute constipation because of its slow onset of action? Options are glycerin, bisacodyl suppository, xylem, milk of magnesia. So the answer is option C, that is xylem. Glycerin and the bisacodyl suppository all produce stools in 30 minutes to a few hours, whereas xylem, a bulk forming laxative, produces stool in 24 to 72 hours in the same manner as a normal bolus of food or fiber. Which of the following is the most common sign or symptom of hemorrhoids? Options are bleeding, pain, seepage, pruritus. So here the answer is option A, that is bleeding. The most common sign or symptom of hemorrhoids is painless bleeding occurring during a bowel movement. So that's all for today. Thank you and have a great day.